Enough is enough. Placards in New York City were seen screaming out these words as the nurses of city hospitals in the United States go on strike. Just a month after the UK health professionals staged massive protests, 7,000 nurses staged a protest over pay and understaffing issues in New York, in a move that caused one of the facilities to postpone procedures and appointments. The healthcare professionals came out together to register their complaints as the contract negotiations stalled over pay and staffing levels.
So the nurses at Mount Sinai have basically come together to say that we're tired of being exploited, we're tired of our patients being abused, and most of all, we're tired of seeing them not get the care they deserve. We came into nursing to take care of people because we care about them. We come from compassion. And it's very difficult to come into the hospital every single day and know that we're not able to give them the care that they truly deserve. These hospitals have shown that all they care about is profits, but we are no longer treating patients like transactional items. They are people and they deserve respect, and that's why we're out here striking. It's not about money, it's actually about saving lives.
After failing to reach a contract agreement on Sunday, the nurses from Mount Sinai's main hospital and Montefiore Medical Center in Bronx went on a strike. While on strike, the nurses are negotiating for higher pay and increased staffing as they attempt to reach an agreement on the contract. The New York State Nurses Association said it was being forced into to take drastic steps because of chronic understaffing here. That leaves them caring for too many patients at once. The walkout involves as many as 3,500 nurses at Montefiore Medical Center in Bronx and around 3,600 at Mount Sinai Hospital in Manhattan. These are the last of a group of hospitals with contracts with the union that expired simultaneously. The Nurses Association had initially warned that it would strike at all of the hospitals at the same time, resulting in a potential calamity even as a city with as many hospitals as New York. But one by one, the other hospitals struck agreements with the union as the deadline approached. Mount Sinai's administration said that the union's focus on staffing to patient ratio ignores the progress they've made to attract and hire more new nurses. Despite a global shortage of healthcare workers that is impacting hospitals across the country, if the nurses strike, patients are likely to see disruptions in care such as emergency room visits and childbirth. For more on this, our correspondent Susan Tehrani has sent us this report from New York. Listen in.
Both Mount Sinai and Montefiore hospitals have cancelled elective surgeries for now due to the strike, and Montefiore worked through the weekend to discharge as many patients as appropriate for the time being. Mount Sinai on the Upper East Side, because it had about a 10-day notice in case these negotiations fell through, decided to transfer some patients to other locations. Also, both hospitals are seeking to have ambulances be diverted to other medical centers. The New York City Fire Department is cooperating in that regard as well. Susan Tehrani reporting from New York for WION World is One.
WION is now available in your country. Download the app now. Get all the news on the move.